I'm Dr. Michael Thurman. I am an associate professor of medicine in the section of hematology oncology at the University of Chicago. I would like to discuss abstract 7003 from the ASCO meeting from Garcia Monero, efficacy and safety results from the COMMANDS trial, a phase 3 study evaluating luspatercept versus epoetin alpha in erythropoiesis stimulating agent naive transfusion-dependent patients with lower risk myelodysplastic syndromes. Most patients with low risk MDS have limited response to ESAs, and therefore the authors set out to see if a newer therapy, luspatercept, could improve on the standard of care, which at this time is the use of ESAs. They took a group of patients who had IPSS-R low-risk MDS with or without ringed sideroblasts, who had less than 5% bone marrow blasts and a serum erythropoietin level of less than 500, who required red blood cell transfusions. All of these patients were ESA naive. The patients were randomized 1-to-1 to receive subcutaneous luspatercept versus epoetin alpha. The primary endpoint was achievement of red blood cell transfusion independence, and a series of secondary endpoints included various measures of hematologic improvement. A large number of patients were studied. 178 patients received luspatercept and 176 epoetin alpha. And the authors found a statistically significant improvement in transfusion dependence in patients who received luspatercept. 58.5% of the patients who received luspatercept became transfusion independent versus only 31% of patients who received ESAs. The secondary measures of hematologic improvement also favored luspatercept. The toxicities were comparable between the two arms, and the rate of progression to AML was also comparable between the two arms. So the authors found that luspatercept was safe and effective and superior to epoetin alpha in transfusion-dependent low-risk MDS.